In most communities, the nonprofit hospital is in effect the bit player. It's the for-profit hospitals that are jockeying to provide care and to get out there with some advertising and some new promotionals and be at the cutting edge of the new technology and bring in patients. And that it's the not-for-profit hospital that's there in effect to add the comfort to the market, to make sure that those who can't pay will still have a place to receive quality medical care. It's the world turned upside down when the nonprofit hospital becomes the bully boy dominant player, because the nonprofit hospital has been given the advantage of not paying taxes. And that means when it's the bit player picking up most of the charity care that has been refused by the for-profit players, that's fine to have that tax benefit. But when the bully boy has the tax benefit, it keeps all of the other hospitals squeezed out. If I ran a for-profit hospital, the last market I would want to go into was a place that already had a dominant nonprofit player. It would be like going into a market where I would be trying to compete with someone, only I'm going to have my right arm tied behind my back because I'm going to keep losing revenues in taxes. I'm going to have to keep paying those taxes over and over, and I'm fighting someone who gets to punch with both fists. That's not a very attractive market. And of course, that means the bully boy gets to stay in the bully boy's position, in control of everything. Back to the consequence of monopoly. That monopoly is not only about restricting choices about where patients can go because there's no place else to go. It's also about restricting who's going to be there to provide that care when the patient gets sick. So the monopoly hospital can decide that it doesn't want to bring in the fancier doctors who may have the more expensive procedures and would raise the standard of care, raise the level that all doctors have to meet or be charged with malpractice, or simply raise the costs. Doctors who may come in and say, rather than, gee, there's nothing we can do, there is something we can do, but it's going to cost a lot of money, and that's going to cost the system money. So it's the ability to tell the patients, you have to come to us, and then make the decision internally what constitutes us in a way that isn't oriented solely toward what's the best possible patient care, but is oriented toward what's best financially for the institution. What leaves us spending the least money to provide the care that we are legally required to provide. And that's important to remember. 99.9% of the people who work for a hospital can be good people who are there to give care. And that's the only reason they're there. But we're talking about an organizational structure. The nurse who sits with you through the night. The good people who are there to make sure the hospital operates to give the best care possible to the people who are sick and who are injured who come in are not the ones who make the corporate decisions to hire lobbyists, to spread around advertising in a way to minimize criticism of the hospital, or, most importantly here, to go after the very patients they work so hard to help get them back on their feet, to try to help them survive a medical crisis, only to get out and be hounded by professional debt collectors to take away what little bit of financial security they might have, to take away their homes, to take away what they might have built up in a little savings, to take all that away from them in order to pay for their medical care. It's a real disconnect. You can have thousands, literally thousands, of good people aimed toward caring for sick people, and yet the overall structure can be one that guarantees that although the patients who come to this hospital may recover physically from their illnesses or accidents, they may never recover their lives financially. Anyone who believes that the charity concept is nothing more than a business model truly does not understand what charity is about. And somehow, at the heart of this enterprise, thinks that providing health care is just like making so much soap or so many cars. It's not. It's about how to alleviate suffering, how to help babies live that might have died, how to help the elderly make the passage when the time has come. And most of the people who affiliate themselves with hospitals, who go to work at hospitals providing nursing care and physician services, and who mop the floor and who work in the cafeterias, are there because they understand it is different work. If they'd wanted to work on a factory line or they'd wanted to be in the business of selling stock futures, they could have gone off and made more money elsewhere. They could have done other things with their times and talents. They came to work at a hospital because they understood that it was different, that it was as much a calling as it is a business. When the person in charge doesn't understand that, it directs the whole enterprise in the wrong way. It moves it away from what makes a hospital special and what gives us our special trust in a hospital, and makes it selling soap, selling cars. I don't want to do that with my health, and I don't want to do that with the health of my babies.